Welcome back to Revitalists Podcast, where we are changing the narrative for all of mental health. So today I am super excited to welcome one of my warriors with this company, Matt Dolan. And we're going to get down to the nitty gritty on some different pieces. But I think this will be a really cool podcast to where we can kind of focus on like the dynamics of ketamine and consultations and all this other stuff. Because Matt and I have done our fair share of patient care, not only in consult aspects, right, but actually being boots on the ground. So I know a lot of people have questions about ketamine. What does it do? What does it look like? Who are the appropriate age frames? What contraindications are there? All these different things. So between Matt and I, we've got you covered. So Matt, thank you for being here.
I'm so happy to be here.
Yeah. So Matt, give us a little bit of your background so people understand where you're coming from, provider wise and all that other stuff.
Yeah, so I have actually this year marks my 30th year as a nurse.
Congratulations.
Thank you, I guess. Been doing anesthesia going on 25 of those years and finishing up a psychiatric nurse practitioner program as well. Like have got a clinical anesthesia background, which, all that preparation with pharmacology and patient care and all that is really indispensable for being a good provider in the space as far as ketamine infusions go. But so that's my background medically. I'm also a Army combat veteran, so have that perspective as well. So.
Yeah. Yeah. I mean, Matt and I met in 2021, early 2021. Yeah. And, we've been through with this company, highs, lows, explosions, as we've tried to, kind of understand these different paths. But I think the really neat thing is that we've evolved, right? We come in as, pretty confident providers, as anesthesia providers. We're pretty confident in the hospital. We're pretty darn skilled at what we do. And, but coming out and kind of seeing this firsthand with ketamine, we've been able to kind of evolve even our practices and protocols because it's a very evolving field. The neat thing coming from an anesthesia background as well as a nursing background is we do understand a lot of the interventions from like the physiology aspects from an anesthesia standpoint, right? To where we understand cardiac and respiratory and your vascular system and all those things. But the other neat thing is from the nursing background that we have, we really come at it with unique communication styles. And being a nurse by trade, we're able to not only understand the communication strategies of provider to provider, but we're also here to hear from empathetic, compassionate ears that have kind of been, drilled into us as a nurse with these patients and clients that are trying to advocate for themselves, but really they hit walls in the outpatient world.
Yeah, and that's something that I saw early on as a nurse working in the hospital is that there are so many types of providers in the medical community. There are, physicians, there are surgeons, there are dietitians, there are, occupational therapists, physical therapists. And a very typical patient experience, whether in the hospital or some other type of clinic, is they talk to this person for this, guidance on this specialty or see the surgeon for this or that. But there tends to be spaces for lapse of communication or cracks in, where everything that patient truly needs kind of gets lost in the mix because there's not necessarily one person sort of overseeing everything and making sure that the patient gets everything they need. And I saw that really is where the core essence of nursing really is. We are the guardian for that patient. We are that element that is watching over that patient through whatever journey medical journey they're experiencing and making sure that things don't get missed, that things don't get lost, that they get everything that they need. And I really, early on, I mean, that made such an impression on me. I guess naively, when I started nursing, I had this image in my head of what a lot of people think of when they hear nurse, which is, oh, yes, doctor. Oh, let me change that bandage. Oh, yes, here's your pill. Yes, doctor. Which, I mean, there's that aspect to it, but nursing is so much more than that. We are there to make sure that that patient gets everything that they need, that that patient stays safe, that that patient knows that they are being cared for and that they're being watched over, and that really translates so importantly in this space,
Hmm.
with in the mental health world and ketamine infusions and all that.
Yeah.
Patients want to know, hey, I got your back. I'm here. I hear what you're going through. I understand it. We are literally here for you.
And that's the one thing I think a lot of people don't realize, right? Is nurses are trained. It's drilled into our heads that we are the advocate. We are the patient advocate, period.
Yep.
Right. So when we look at that patient or the client, right? So it's more patients in the end. When we say patient versus client, it's patient if you're in the hospital, it's client if you're in the outpatient world. You're basically the same thing, right? You're being cared for under someone's professional protection per se. And but to be an advocate as a nurse, what we do, as you know, we look at the person and we see where are their strengths and where are their weaknesses. How can we best help them to improve their quality of life? And that's what we do. Like, so in the hospital, right, we would see somebody like, their blood pressure looks high. I see that they're on these certain medications. Like, we need to go ahead and get somebody to call in a cardiology consult. Or, hey, they're not breathing correctly. We need to look at calling in a pulmonary consult, or different things like that, right? So we had so much influence on helping to advocate for all these people in that field. And that's a beautiful thing. But, now comes this beautiful world of ketamine and psychedelics. And what I'm seeing is in this space of ketamine and psychedelics, there's no one really that has been trained to be a true advocate for every level of systems to that person, right? Whether that's psychosocial, whether that's any type of physical or mental health. Like, nurses are trained to look at every level of system on that person. Now psychedelics come up and they're making everybody vulnerable on a comprehensive level, right? To where, you really need to understand not only the mental health aspects and the behavioral aspects and the psychological aspects, but you need to understand, like, how are these stressors impacting their vascular health, their cardiac health, their liver health, their renal health, right? With their kidneys. And it's like, how are you making all these connections? And honestly, and correct me if I'm wrong, I don't know if there's another profession out there other than nursing that has been taught to be that advocate for that person with all of the specialties and the interventionalists surrounding that person. Like, I feel like it's a nurse,
Yep. 1,000%. Yep.
you know?
Yep.
And then the cool thing, like, people, like, then we become anesthesia providers. And as anesthesia providers, I mean, we're badasses. I mean, we really are. Like, we start lines, we do blocks, we put people on ventilators. We have 1 billion drips going at one time. We help with open hearts, help with brains. You do epidurals, you do spinals, you do emergencies, you do gunshot wounds, right? You do all these things. And, we are highly trained critical care specialists. And people don't really understand, the capacity of anesthesia providers. And they look at it like, that it's boring and all this other stuff. And it does look boring because, why it looks boring is because we perfected it. Like, what is it? Anesthesia and pilots are two of the safest professions out there. And it's because we've made a beautiful art of practicing medicine. We have made anesthesia into a science.
Yep.
And we're very good on that. So the cool thing about bringing people in like me and you into this world of psychedelics and mental health is you're bringing these professionals, and we've had our tails kicked in anesthesia school, this, and in the OR, right? Like, they beat you down to
Yep.
build you up. And I don't even know if they build you up. You have to do that on your own. But we're in the hospital. We understand all these things. We got pretty good egos, right? Because our skills are just amazing in the hospital world. And we're like 99.9% effective with anesthesia in the hospital. Well, then lo and behold, you take people like me and you and you put us into this outpatient world called mental health that's maybe 30% effective, if that. And when we come out, we're like, wait a minute. It's like this car slamming on its brakes. It's like, hold on. How can you be this ineffective when you're looking at the brain? Right? So we're coming from this, neuroscience, neurologic standpoint, and now we're coming into the mental health world. And honestly, I'm sure you're as baffled as I am sometimes, but there's been so many times I've been like, you're doing what? Why? Why are you doing that? And it's us asking professionals or patients in the outpatient world, why are you doing this? Tell me why. Because in the anesthesia world, we know it down to a chemical science. We will tell you why all day long, exactly as to why we're doing something.
Right.
And in the outpatient world, you start asking people why, and they just shut down. Like they're like, I don't know. Because it seemed to be helping them. I'm like, through what level? Like through what mechanism of action, right? And then we'll go down to my brain goes to chemical structure breakdown and pathophysiology. But most of the outpatient world has not been trained in that capacity. So it's much more of a theory that we're addressing instead of a true science. But now with ketamine and psychedelics, these whimsical voodoo-ish medicines, as people want to say, are actually showing us the most scientific, repetitive patterns that we've ever seen in mental health. So that's the exciting thing about all this is us bringing in their anesthesia mindsets, updating protocols to where it's starting to make sense because consistently we know what makes sense. And now we're actually implementing that into the community environments.
Yeah. And that, it's interesting that you brought that point up because the irony or one of the ironies is that because people, are just, a lot of people are just now hearing about therapeutic psychedelics. Most people have heard of LSD, acid, psilocybin, ketamine and all that kind of stuff, but they don't, it's always been historically in the context of recreational use. And so a lot of people are hearing about this. Well, okay, these things can be therapeutic. So it seems like it's this, like you said, voodoo, fringe, experimental. The irony is, and we'll get into this about ketamine, is the way that those agents work to facilitate improving symptoms of mental health, depression, anxiety, whatever. The research into those has arguably been some of the most profound and brightest spotlights shining on, here is why this stuff works. Here is, to take the example that you talked about, touched on traditional antidepressants, and I'm not knocking them, but traditionally antidepressants, they boost one or more of the big three neurotransmitters: dopamine, serotonin, norepinephrine. And the operational theory for decades is depression, anxiety, other mood disorders are based on imbalances in neurotransmitters. And when we give a drug that boosts the level of serotonin, eventually for some patients we see improvement. And so sort of by a regressionary logic, therefore depression is or potentially caused by low serotonin. Well, when you take, when a patient takes a drug that boosts serotonin or an antidepressant, it typically takes weeks to months before they see, in any sort of improvement. In reality, chemically, the first pill that they take increases the level of serotonin. So it's not, the operational theory is, tying low levels or imbalances in neurotransmitters to, whatever. If that were the case, the first time or second or third time the patient took that pill that boosts the serotonin, they should start seeing results, right? So that's not, it's not an issue of, it's low, serotonin, it's low norepinephrine, it's low whatever. So it's been through the research and the understanding and the just the incredible explosion in understanding of what ketamine does biochemically, directly and indirectly, and the effects of those chronic chronic mental health conditions that they have on neurons. That has actually enlightened us on why why traditional medications work when they work, So ironically, it's been the therapeutic psychedelics that have enabled a much deeper understanding of traditional approaches pharmacologically to mental health, so instead of it being this weird thing on the outside, well, we're not really sure, with the decades of research specifically in ketamine and other psychedelics has helped us understand why traditional antidepressants work when they work. So I I, I find that deliciously ironic.
Right. Yeah. Because it's upside down and inside out. And, that's something they were talking about the other day. I was talking to some scientists and they were saying how now they're looking at serotonin, dopamine, and norepi, that those guys actually travel together. Right. So if you're taking SSRIs, SNRIs, or whatever, it's actually also changing your levels of dopamine and norepinephrine as well. We've just not looked at it that way, right? We've only been focused so unilaterally in such a siloed piece that we don't see we're changing the entire landscape of the brain, right? And that's another ironic thing. When you talk about this, like, yeah, this podcast should be called irony. But when you're looking at all those different pieces in medicine, we go from least invasive to most invasive. And what we do right now is we think, oh yeah, take SSRI, take SNRI, right? Take something, down those levels. And those medications are changing the entire landscape of your brain. And it's something to where you have to be on it for 6 weeks at a time, right? And then when you start getting off of it, right, then you have brain zaps, you got all these side effects. And so are we doing actually the most invasive technique first, because it's changing everything, right? Versus like ketamine and psychedelics. Ketamine is a 40-minute infusion. It goes in, it gets out. It's got something called a short half-life on it, right? So it just peaks, has its high, it has its low, and it's out of your system. And, it's kind of the same way for psychedelics, even the macro dosing, the bigger doses of the psychedelics. It gets in and it gets out, and it's an intervention.
Mm-hmm.
People think that medication management is a softer way to actually come in and look at these things. And in reality, it's not, because so you're putting somebody on a medication and yeah, hopefully it helps, but really you got to be on it for 6 weeks. And then you really need to effectively taper off of it. So that, which is technically probably another 6 weeks, right? So for somebody who's struggling with something acute, or short, comes on quickly or whatever else, right? And then we're saying, okay, we're going to try this one intervention and it's going to be around 3 months to see if it works, or for you to get back to what you were.
Mm-hmm.
And are you ever going to be back to what you were? We don't know.
Right.
Right. Versus a ketamine infusion, come in, you're going to be in the office for about 40 minutes. It's about an hour and a half. And then, yeah, it's an intervention. The next day, did you feel any different? Change is change. Some people after one session, they may feel amazing. Other people may be like, oh gosh, there's a lot of stuff here, right? And it takes a second to have all these things to where they actually align to where it starts making sense. But and I think this is what we need to really hammer on, and I've mentioned this a few times at different places, we have failed in mental health, period. And people still want to try to keep it alive as to what we're doing. And we need to close the chapter, close the book. We need to close the book on mental health, and we need to open it up with a new set of eyes. And if that new set of eyes is we need to do interventions with ketamine and psychedelics, and then we need to see how medications can help support or manage those things after an intervention, because we're not intervening until right before death. That's when we're like, oh, here, try ketamine after you've tried all these meds, right. Then try ketamine. Or better yet, let's do generalized electrocution to your brain called ECT, right? Which is the quote unquote gold standard for depression since 1950. And that's just, when you look at these things, ECT, so ECT, electroconvulsive therapy, Matt knows this well because we used to do anesthesia for people having ECT therapy. But, they get 6 sessions of generalized electrocution that's causing them to have a seizure that we want to have, greater than 10 seconds, but less than 60. And they have these seizures, and it's supposed to create regeneration, but nobody really understands why, right? That's only one aspect of it. The other aspect is 6 times over 2 weeks, we are giving these people 6 general anesthetics. And we know for a fact that repetitive general anesthetics actually create damage to the brain. So here are these people, not only are we giving them 6 general anesthetics in 2 weeks, which is already damaging to them, we're also electrocuting their brain, which who knows, right? I mean, who was it? Not Jackie Chan, Bruce Lee. He died from electrocution, I believe, where he used to do that to himself sometimes. But then also, we're also creating a hypoxic environment, which is, low oxygen, allowing them to have a seizure with that piece as well. So it's like ketamine, we see ketamine and psychedelics are acting as an agonist to where they're actually promoting growth.
Right.
The current system says, create death first, then we'll promote growth. And it's like, what are we doing? Do we have any idea what we're doing? I mean, me personally, I really, and providers don't necessarily like it. And I will invite any provider to be on this podcast. But, but when I start going down the rabbit hole and I just say, well, why do you do that for? Why do you do that?
Right.
How come you do that for? And a lot of times they'll be like, brain's just complex. It's difficult. I'm like, but you got to have some type of reason as to why, right? And as you know, as anesthesia providers, they Googled questions for us while we were sitting there putting a 2-pound baby to sleep, for open heart surgery. You got to know your stuff. Yep. And in the mental health world, the general landscape they do not understand the way the brain works. And they're very resistant in trying to hear other mechanisms because it makes them uncomfortable.
Yep. 100%. And it's again, with the irony, I think that it's funny in one of the presentations, PowerPoint presentations that we've given, I've got a couple pictures of skulls that, with holes drilled in, because that was, hundreds of years ago or whenever, that was seen as a legitimate attempt to treat certain mental illnesses. And we laugh at that now and gosh, how primitive. Well, I think we're going to get to the point where we look back at things like ECT and go, oh my gosh, how embarrassing, how primitive. But, it is kind of been one of the things that we've been doing for decades. And so it's worked sometimes.
Right. And some people do, right? Sometimes it breaks them. But it's like, if there's something that we could do besides, sending generalized electrocution to the brain, I think that'd be great. But it's like radiation, to the brain, right? When people used to get brain cancer with the radiation aspects, it's like, you want to radiate the whole brain? And, now we at least have these knives, these radiation knives, to where we can actually go into where we see the insults kind of there. And then we can go there and do radiation to that specific part of the brain versus radiating the entire thing. So it's like ECT, for people out there who believe in ECT and they've seen it work and all this other stuff, I really would challenge you to also go back and look at the people who have had ECT and talk to them about the trauma that they've also received.
Yep.
Because I was told when I used to sedate for it that about 1% of people had memory loss, and that statistic is wrong.
Yeah, I think it's much higher.
Me personally, everybody, and I ask this specifically, anybody who I've talked to who has had ECT, I'll ask them, how much of your memory did you lose? 100% of the people I've talked to have lost some type of memory. And that could be decades. One lady lost 20 years of her marriage. One lady lost her entire son. Her son died, created this severe depression. She lost her entire son's childhood, which again created more depression from that. So, the loss of memory is huge. It's significant. And we really should look at people who have had ECT. Look at the success cases and follow those and keep creating the protocol that makes the most sense, because there's still a lot of people that are having damage done by ECT and nobody's updating their protocols based on what they're seeing in a negative light, which they should be doing that.
So I think one of the things that pivotal difference between what we're looking at with the results of therapeutic psychedelics, specifically ketamine, is just a profound change in the paradigm, in the approach to treatment. Traditionally speaking, with ECT, with traditional psychoactive medications, the goal really is symptom masking or symptom management. It's not necessarily take this because it's going to really help you get to the root causes, work through those, and move past those. It's take this and it'll help you feel less crappy, maybe,
Hmm.
hopefully, you know.
We think so.
And that is one of the absolute fundamental differences between, the use of therapeutic psychedelics is not only, and again, specifically with ketamine, but also other therapeutic psychedelics, not only do they facilitate healing biochemically, but they really facilitate processing of emotional causes of, which then produce symptoms of depression, symptoms of anxiety. And that is just one of the biggest difference between the approaches, the paradigms, the way of thinking, of approaching is these medicines, these therapeutic psychedelics are tools to facilitate healing versus something to just kind of make the symptoms less bad for a
Right.
while, maybe,
Right.
you know.
And I think that's the piece, right? That you've got the acute piece there. And I think that's the narrative that we need to change here is like with mental health, right? There's something that creates these symptoms of negativity. And with medication management, people get on meds to manage those symptoms, right? But the symptoms are still duplicating themselves. They're still going to continue to get worse over time unless the cycle is broken. So if we can break the cycle, which is what we see with ketamine, then we can do a true assessment of the person. So I think that's the piece. People are scared to death of ketamine from the way that we're like, oh, you got to fail at least 4 medications. Should you try ECT first? Should we electrocute you first before you do ketamine? And it's like, no, like, what? Hold on. Everybody just step back. If you are having trouble with your mental health, ketamine should be the first step that you consider in a controlled environment with a therapist who can do a true assessment. So you're getting a true assessment from a medical provider as well as a behavioral provider, and they can kind of see what's causing this conflict. If we can identify from a subconscious level what's causing that conflict, then we can give you tools that are going to help you to move into the level of health instead of continually going down this negative pathway. So even those tools, it could be meditation, it could be yoga, it could be exercise, it could be healthy relationship management. Those are things that are just like, accessory things. And then we could look at like, okay, you've tried that. Okay, now let's look at what medicines may help support this. But let's also go back and let's keep those interventions in mind. Because what we're seeing, I could go, and you could too, because we know the brain so well now, you and I could go into any type of primary care or psychiatrist and receive a different diagnosis each day based on how we're acting. And, and people, it might be that people are having a bad day or they do feel sad that day. Well, it just happens to be the day you're going to your primary care. Well, is your primary care going to diagnose you with depression that day because you're just having a bad day? When maybe you're not even depressed. Maybe you're just having a bad time, So your providers are making an assessment based on not the true root cause of what's going on, which is what ketamine allows us to do, is to kind of see it like so much clarity there.
Mhm.
And then we can, help the person out much more. So like say if somebody, wants to talk about ketamine or they don't know anything, right? I don't know about ketamine.
Right.
Right? So it's spelled ketamine, but it's ketamine. But I don't know anything about this. Like who's this good for? Like who wouldn't it be good for? So like, who would you say, diagnosis or non-diagnosed, people who are dealing with symptoms of, who would you say are the best candidates to look into ketamine infusions?
So, the traditional big four, and I say traditional, this has kind of been what the focus, over the past 20, 30 years, as far as ketamine therapy is depression, anxiety, PTSD, and then chronic pain syndrome. So we'll stay kind of on the mood stuff. But again, as the research, and again, just specifically talking about ketamine, but not to the exclusion of other psychedelics. as the research has progressed with ketamine, not only what it does biochemically, but also, that pointed the arrow towards looking at changes in neurons that occur with chronic, stress, chronic depression, chronic anxiety. Um, essentially, depression, anxiety are chronic neurodegenerative disorders that are caused by oxidative stress from, ongoing overactivity in regions of the brain. And there are some ways that ketamine works biochemically that helps regenerate, renew, rebuild neurons. So we've been focusing on depression, anxiety, PTSD as far as the mood stuff, but we're also seeing increased research now based on an increased understanding of what ketamine does into ketamine for other types of not only behavioral disorders, like OCD, ADD, ADHD, but also other medical neurodegenerative disorders like Parkinson's, things like that. But our meat and potatoes, so to speak, patients are seeking help with symptoms of depression, anxiety, PTSD, with the mood stuff, and that's what we have seen consistently good results. Throughout the progression of their infusions or whatever method that of therapeutic ketamine administration they're experiencing. So, um, but another conversation is addiction and addictive behaviors. And there is a fellow that has published a few papers on success of treating various types of substance abuse disorders. But at its core nature, addiction is there are some physiological aspects to addiction, of course, depending on the substance that a person has been using or struggling with. But there is a huge behavioral element to addiction, which is typically generated by emotional issues, unresolved emotional traumas, other types of traumas. And ketamine really helps, again, get to the root cause. Ketamine really helps open up safe channels for the brain to allow those things to come to the surface or to the front, to our consciousness, and really facilitate healing. So yes, it's typically people suffering with depression and or anxiety and or PTSD, but when you zoom the lens out, facilitating being able to get to those root causes also improves other things, like people that are struggling with depression, whatever, or I'm sorry, addiction issues, whether it's a chemical or a behavioral addiction, or other types of addiction. So again, the big three: depression, anxiety, PTSD, but we're really seeing that it can really facilitate healing in a lot of different ways besides just those
Mhm.
traditional three.
And I think too, people, they're so focused. And this is the other thing, with anesthesia is we may be one of the only providers out there that are necessarily trained on treating symptomatology, not treating the diagnosis. And people love to treat a diagnosis. As much as they say they don't, they do, right? It gives them this sense of control, I guess, when they think that they've like solved the issue. But that DSM just keeps getting bigger and bigger and bigger with all these diagnoses. And we keep siloing, all these different pieces to where I'm like, okay, hold on. It's like it's almost like research and all this stuff. We just keep going down this rabbit hole and we just get much more granular, more specific with all these things to where honestly, maybe we just need 5 diagnoses in the DSM. Maybe we don't need 8,000 chapters in looking at all these different aspects, because we're seeing that a lot of these diagnoses, even though they're maybe moderately different, they're all overlapping. And who knows? I mean, I know the core is the brain, right? And that's the neat thing, I think with ketamine and psychedelics and things like that, is it takes us back to the core root. But I think a big thing there is you don't have to be diagnosed to seek out ketamine and psychedelic therapies. The people that I love when they come in, because it's such an evolving field, are the people who come to us and they say, I don't feel right, something's wrong, or I'm stuck.
Mhm.
And those 3 things, right, are them admitting like something's wrong. Like, I always say it's conflict, so like something's not there. But what typically we'll do, right, in the mental health world is we'll send you to a therapist or we'll send you to a primary care. Keep following up with them. Let's start you just on something real light, just a real light SSRI, right? Let's go ahead and start changing those neurotransmitters that you got going on. But instead, of people having to go down this road, well, first I got diagnosed with anxiety. Then they put me on something for my anxiety, and it wasn't, I mean, it wasn't anything bad. It was like as needed, a Valium as needed.
Mm.
And it did work. It worked for a while. And then I was taking it all the time. And then it stopped working. And then they diagnosed me with depression. And then they put me on all this stuff, and that SSRI, it worked out great for a while, but then it stopped working, and now I'm on like seven, so it's like it's the same story over and over and over. And you know, with the whole like anxiety piece, when they put people on all these anti-anxiety agents, and then it creates depression, right? So people are on benzodiazepines, right? Xanax, Valium, clonazepam, Klonopin, whatever, right? Those little guys. When people are on those, it makes depression worse.
Yep.
And not only does it make it worse, it makes it harder to treat because it numbs everything, right? So people who come to us, like, I love the people who say, I just don't feel right. I've tried exercise, I've tried yoga, I've tried meditation. Something still doesn't feel right. When I hear that, I'm like, oh, you guys are going to do beautiful with ketamine because you've had enough insight to start looking at things on how maybe things weren't working or how you can improve things, more from a psychological level, instead of just going to a provider saying, I don't feel right. Can you give me something to make me feel normal? And normal is what people strive for, and normal doesn't exist. Right. And I think that's the piece of it. When we first started the clinic, back in 2018, it was, lessons learned, right? But we were like, give us three things that you want, like goal wise, right, to achieve from this therapy. And one of people were like, I just want to feel normal. Well, we used to write that down, right? And then even though we saw that like their sleep was changing from like 2 hours to 8 hours, they were eating 3 meals a day instead of eating 1 meal a day. They were actually bathing daily now, to where used to they would go 6 weeks without taking a bath. Like, we saw all these positive changes, and the people would be like, I still don't feel normal. I'm like, no, but like, look at this. Like, you've had all these improved, these positive changes. But what happens is people strive for normal. And normal doesn't exist. So it's like this, inflated sense of false narrative that we're striving for, and we're never going to hit it because it doesn't exist. And, and that's the piece to where it's like now, right, with ketamine, when people don't feel right, but we can sit down with them and say, what are your intentions? And then what are your goals? And give me goals that are measurable, right? Because you have to retrain your brain to understand what that measurement looks like. Because if you're setting yourself up to feel normal, to feel more normal, or whatever you want to do, you're setting yourself up for failure from the beginning, because you're giving yourself an unachievable goal.
I do. I tell people, some way I try to describe it, that kind of thing is, the body is like, from the moment life starts until we die, the body is in a constant, never-ending process of seeking homeostasis, balance, whether it's acid-base balance in a cell or fluid level in or outside of the cell, blood pressure, whatever. The body is always seeking a balance, but there is no, okay, we're balanced, done. It's a process. It's an ongoing process. It's not, it's not, we're there, everything's done, right? It's the body's okay. I've always got to be in the process of seeking that balance. And so I do think it's a very major part of the human experience too. We all have this, what should be, right? What normal should be, and sort of a manifestation of that is this, a lot of people walk around with what they call imposter syndrome or whatever, like, in a way of explaining that, or whatever, is the whole ducks on a pond, on this, if you watch ducks swimming across a pond, they look so graceful and smooth, but if you look underwater, they're paddling like hell to stay afloat, right? Which is kind of how most of us feel. And there tends to be what I call like a grand illusion when I talk to patients, that we look at everybody else that we encounter, and we for some reason create this idea that, man, they're all doing really well. They've got their stuff together and all that. I'm so messed up inside. And if people only knew, the reality is that almost everybody feels that way, that everybody else is like really got their stuff together, and that's, oh, they're doing really well. Why am I so messed up inside? Well, if we all took the masks off for just a minute and just dumped it all out, we're completely honest, we'd realize that that's what normal is feeling like I'm messed up and everybody else has got their stuff together. Well, no, that's really kind of more the norm, So you're right. I mean, people, for some whatever reason, we get this idea of what normal should be, and then we start, and it's, that expectation, which is pretty unrealistic, then generates its own anxiety and depression of, oh, I'm so messed up and why can't I just be normal? Well, you know what? You're more normal than you realize, and being normal, being healthy, it's a process. It's an ongoing process. You never fully get there,
Right.
you know?
And what is normal, right? Is normal common? It's like, I just want to be common. I want to be like everybody else. And right, exactly what you just said.
Yeah.
Everybody else is
Guess what? You're
struggling.
like everybody else already. You just don't realize it,
Congratulations.
Yeah.
Right. Yeah. And that's something that I like to talk about a lot too, is like present, is being in the present. When you hear therapists say that way more than anybody else, right? And therapists are trained to learn to live in the present. And they may be the only ones who are truly trained to live in the present moment, unless it's like yoga or meditation, right? With those pieces. But, the more that we can teach ourselves to truly understand what it feels like to live in the present time, that's where ketamine and psychedelics will take you, to sit with yourself in the present. But two, that is what, if people are seeking quote unquote normal, and to me, normal would be, even though people say normal, I feel like they're probably saying they want to be peaceful or calm or level-headed
or happy.
Right. And I think if we learn to live in the present moment, that's what we're striving to do. It's just the fact of the matter is, people who are struggling with their own mental health or struggling with pain, they're scared to death to live in the present. But like I tell them all the time, I'm like, the present's all we have. Past is gone. Future's not here. And we're constantly living in the past or living in the future because we're trying to control our own narrative. We're not aligning with our narrative and leading the path, which I say is blind faith kind of thing, and taking the next best step. And it's really only the brave that learn to live in the present, which is just crazy, because that's all any of us are in at all times, is the present. And nobody teaches us how to be in that moment. We just expect it comes naturally.
Yeah. One of the things that I tell patients is that, specifically talking about trauma and what the brain does with trauma, is that we are actually, our brains, ourselves as beings, and specifically our brains, we are wired to live in the moment. We are actually built to live in the moment. Our brains are not wired to be a repository to store up a bunch of unresolved emotional trauma. We are not built to do that. And when we compartmentalize trauma, and instead of working through and processing that, when we just throw it in that back room and shut the door, our brains are not wired to do that. And even though those things typically stay in our subconsciousness, our brains are constantly in the process of trying to bring those unresolved things forward to work through them, because our brain's like, man, this is painful, this hurts, I need to get rid of this, we need to like dump this. But as that trauma comes closer to our consciousness, it triggers a threat again, and the brain's like, no, shove it back, this is dangerous. And so like that again is another irony is we inadvertently create many of the issues that cause symptoms of depression. I understand and relate to the world through analogies. So it's the way I work. And so like when I'm talking with patients doing a consultation or whatever, I throw out a lot of analogies to kind of describe, how ketamine works and how ketamine assisted psychotherapy works. But I jokingly say that these things that we keep inside, these unresolved emotional traumas, it's sort of over time, over the course of our lives or years or whatever, it's like our brains need to take a big emotional fart or a big emotional dump, and we just won't let it and won't let it and won't let it. And if we do that physically, we'll start to cramp and hurt and have incredible pain. And symptoms of depression, anxiety are the brain starting to cramp and hurt from that stuff building and building and building, and the brain wants to get rid of it, but a big part of our psychological defense mechanisms and ego function is to keep those emotionally threatening things back in the shadows where they can't hurt us. Well, actually that creates more
Mm-hmm.
more damage than actually bringing that stuff forward and processing. It's like an infection abscess in the body. You pop it and that stuff comes out. It's going to stink and it's going to hurt. But you know what? Keeping it inside is going to cause a lot more damage in the long term. And that's what that unresolved emotional trauma
Mm-hmm.
is just emotional abscesses, growing and growing and growing.
Yep. And I think that's the neat thing with ketamine specifically is it allows the brain to go into a present moment to where you're not connected to anxiety, depression, nothing. You're just at one with, right? And you're like, I mean, people will be like, oh my gosh, I feel like I can take a breath. And you're like, yeah, that's cool, isn't it? But they're kind of in this vulnerable space a lot of times. And then the brain will start bringing up these things, right, that has been holding on to. And it scares people to death when I say it's going to bring up things from the past. And rightfully so. They're like, I can't handle that,
Right.
right?
Sure.
But the beautiful thing about ketamine is it disassociates the emotion attached to the memory.
Right.
So therefore, it doesn't matter what it brings up. It doesn't matter if you've been raped, if you've been shot, if you've been whatever else. It will bring it up, and you're looking at it from like, oh gosh, that was horrible. You don't feel those emotional, intangible, connections that are enmeshed. Instead, it's like you're watching it on TV, and you're just like, oh yeah, that was bad. But literally, you're looking at it from a objective analytic standpoint,
Right.
and you're not feeling that emotion. So what happens, right? And this is the cool thing about ketamine, our voodoo medicine and quantum physics, which people, quantum physics is like the ultimate cool sciences sometimes. But now that they look at time, and our brain doesn't understand time, it just doesn't. That's why we have watches. That's why we have clocks. That's why we have to look at sundials. That's why when we're blind, we have to take the medications to let us know, like, all the sleep cycle things and things like that. But what they've proven now is when you go through these heavy events in life that your brain's holding on to, and when the emotion comes up, we don't want to hear it, right? What they're proving now is the brain doesn't recognize time. So if it's a trauma that occurred 45 years ago and the brain brings it up, the brain may have the exact same response, emotional response today that it did 45 years ago. And that's why we don't want to bring it up, because we can't relive the moment again. It took too much of our life, all this other stuff.
Right.
And that's why we suppress these things. But the beautiful thing about ketamine is it allows it to come up and you're not connected to it. And then you can analyze it. And when you're analyzing it, I mean, I tell people it's like a 4-year-old coming up and screaming, being like, I've had the worst day ever. Okay, I hear that you've had the worst day ever. I really do. But let's talk it through. So you're having this like administrative parental moment with your own self to where your brain doesn't look at it as a threat anymore because you were able to analyze the situation. And the neat thing too is, when we go through these heavy things in life, we get stuck on what we thought was the most heaviest of that. And most of the time, our brains already actually process most of that heavy stuff. As you know, with ketamine, when heavy emotions come up from people or heavy memories, it can be the dumbest thing that the brain held on to during one of the most difficult times in your life. You'll be like, oh no, I had this acute death. And your brain's like, but do you remember there was a bluebird on the tree? And they're like, I just keep thinking about this bluebird on the tree that day. And I'm like, well, you know what? Who knows, right? Because this is all still evolving. But maybe this really, really heavy situation that you had in the past, your brain's processed all the heaviness. But the reason it keeps coming up is because your brain got stuck on what grounded you that day. And maybe what grounded you was that little bluebird. So we just need to talk about the bluebird. And then the brain will, it literally, it releases it.
Yeah.
It's gone.
Yeah.
They don't feel the emotional connection to these things that are literally making their life hell.
Mm-hmm.
And, and I always use I use analogies too, but I like my examples to be very strong so people really understand what I'm trying to say. But one thing I'll tell people is like, say you have two women that have been raped. One female says, gosh, you know what? That was one of the worst times of my life. Like, I never want to go back there. I mean, I lost it. Like, I lost my mind during that time, but thank goodness it's over. And now, I've worked on myself. I've been able to really move on. And, so glad that's gone. That's woman A. Woman B says, I can't talk about it. It's too much. It's too much. We look at each of those females as, oh, well, that one's stronger and this one's not. But what female A did that can actually talk about it has actually analyzed the situation without having those emotions attached. The brain puts it into the long-term memory to where the emotions are not with the memory anymore.
Right.
And that's why she can talk about it, because literally when she speaks of it, she doesn't feel any zero emotional attachment to it, right? It's like me sitting here saying, like, I really need to buy this cowboy hat and I want to cry about this cowboy hat. It's like, this lady has no emotional, like her rape is almost looking at like buying a cowboy hat. There's no emotional attachment to either of those. Versus the other female who can't talk about it because every time she brings it up, the brain thinks it's happening again in real time. And that's why people don't want to go through these things. They want to repress these things. But the neat thing about ketamine and psychedelics is, it brings it up and you don't have that. And I can't like overemphasize that enough. It will bring up, and as you know, like it brings up the color yellow. I'm like, if the color yellow comes up, there's some significance to it. Follow the color yellow, But the brain brings up substance that it thinks is important that we may not even consciously given two thoughts about. But it's something that allowed us to evolve to the person that we are today. And we all know it's there, but it's like, like you said, it's things that we either hold on to too much and we're afraid to even look at it, or it's just, it's too heavy. And then once we start letting it out, then we think we've got to go all the way back to like when we were a month old and look at those things. So it's almost like the brain just gets off balance on every level possible. And we don't understand where to start. And maybe that's the people who come in who say, I'm stuck, or I don't feel right. I don't feel like myself. And, and their brain will start going down this negative path a lot of times, and it leads to negative outcomes.
Yeah. And I tell people that, whatever, any thought, any feeling, they're electrical pathways, in the brain and the nervous system. And not only thoughts, feelings, but also, physical actions, whatever we repeat over and over and over, we reinforce those pathways. And the more we reinforce them, we increase the odds of performing that thought, that feeling, that physical thing, without consciously trying to do it again. It's where we get muscle memory. Muscle memory is not muscle memory, it's nerve memory. It's reinforced neural pathways that get so reinforced. I used the analogy of car tires. If a car is driving up and down a dirt road a bunch, those tires are going to dig ruts in the road. And the deeper the ruts go, if the tires get anywhere close, they're probably going to slide in the ruts. And when that happens, you don't even need to steer anymore because the ruts are going to take you. And so patterns of thought, of feeling, of interpretation, of reaction get reinforced, and they increase the odds of slipping back into those same patterns. And this is oversimplified, but it's accurate. Anxiety, by and large, is fear of potential future harms.
Hmm.
Depression, by and large, is looking at past harms and ruminating and the woulda, coulda, shoulda. And so, we talk about the default mode network and kind of all that stuff. But when in those, that 2 or 3 a.m., when we wake up and the brain turns on, or other times when we're just sitting there vegging out, our brain tends to go towards anxiety based, you know, things, or depression based rumination, or both. And the more that that happens, the more that we are inadvertently reinforcing the odds of the brain automatically going there. And so one of the neat things that happens, psychedelics in general, but specifically ketamine, is it it enables press pause on those automatic sort of reflexive default thought patterns, zoom the lens out, look at everything from much different perspectives, and go, you know what? This way of thinking, this way of reacting, this way of interpreting this or that I've done for so long, you know what? That actually does not fit anymore. And I don't really need to look at this way anymore. I don't need to react this way anymore. And so it enables the reset that people talk about or read about, how therapeutic psychedelics enable a reset. It's a way for people to pause those thought patterns, those reaction, those interpretation patterns, look at things more clearly, more objectively, and build healthier, happier, more productive, more accurate thought patterns moving forward. And that's the integration part of the whole
Hmm.
process. you know um, yeah, breaking those patterns,
Yep.
breaking those chains that keep us tied to the same thoughts, feelings.
I love that you say the automated thing. Yeah, because I was so like with the automated piece, right? It's like looking at so the youngest we've treated is 12, and we go down to 10, right? But it's one of those things too. It's like people have to be comfortable, right? And bringing in their adolescent for ketamine therapies. So, but you're what we see, right? So let's talk about adolescents. We'll break it down. We'll talk about adolescents, then we can go to the other specialty groups. But say you have an adolescent child and or let's say 10 to 18, put it in that category per se. um these kids, from what I see, they're kids that are typically extremely smart and they have no idea what to do with themselves, and they're coming to us as adults asking for opinions, and we're giving them opinions, but the opinions don't align with what they're feeling. So therefore we put them on lithium, antidepressants, benzodiazepines. And these kids they're typically, like I said, they have high IQs. Their EQs are sometimes they're there, but they're not completely aligned with what they are yet, because they're so smart they don't even know how to keep up with themselves yet. And then us in society, we're not teaching them how to evolve into the level of child that they actually are. Instead, we're medicating them to stay at the level where they are. And and these kids specifically, like, when people are like wondering about like kids and adolescents with ketamine, like I love kids with ketamine. And anesthesia wise, I mean, we treat them a little bit differently in the hospital. But but the kids that I've seen, the teenagers especially, they're so plastic. Like they're looking for structure and they're trying to build structure, but the structure doesn't align with what they know yet. So unlike, our geriatric population who come in and they're struggling, but they're so rigid, our geriatric population, to where if you give them anything of thought altering ability, you got to be careful, right? Because you can traumatize them, because they are so stuck. They're so fixated because they've had 80, 90 years of learning, this is who I am. Well, now all of a sudden we're going to throw a ball in here at you and they're going to be like, okay, what'd you just do? Kind of thing. But the kids are so amazing because when they're on ketamine, one, they think you're the coolest person ever, right? Because they kind of feel like altered, like we got them drunk or we got them high. So they're like, oh wow, there's an adult that's actually doing this, and this is actually proven. But two, it takes down all this structure that we've been giving them in opinions that they've been trying to use as fact, and it still doesn't align with these kids. But during ketamine, takes all this down and allows them to reflect on themselves to where they can then learn to start building their own structure, because their own structure is unique to them. It's unique to their personalities. It's unique to their skill sets, their trainings, their environments at home. And that's the piece of it, is every person that's out there is unique. And we keep trying to blanket them with depression, right? Depression is such a big blanket diagnosis. And then all these antidepressants that are out there are big blankets. And what we can see with ketamine in the adolescent population, we're helping them to boost their emotional intelligence in significant time, or, super quick time, to where they can start actually feeling like they're in alignment with themselves for the first time in their life. And I think that, gives them the freedom that they're looking for, because otherwise, I tell people it's like pouring water on a Ferrari engine. You don't pour water on a Ferrari if it's overheating. It's a Ferrari. You figure out, why is it overheating? And that's what ketamine allows us to do with this adolescent population. Because when you start putting the little guys on medications, what are we doing? We're telling them that they're already ill at this young age, and they're not. They've just not grown into who they are yet. So what would you say if I was a parent and I was like, all right, I have an adolescent child. They're not sleeping. Their grades are going down. They've had, better off dead symptoms, like you'd be better off if I wasn't here, right? Which probably most teenagers say that, but you got to listen to it. And maybe they've tried a med, maybe they haven't. Maybe they've been in therapy, and therapy seems to maybe be helping. I don't know, but I noticed they're starting to cut themselves. What would you tell that parent? Like, I know nothing about ketamine, and I have a child who's doing this stuff.
Yeah, it's the whole process of a human being going through all the different early stages. And I mean, not only are there profound physiological changes happening and hormonal changes and all that, but you're right, there's this being who is an experiential being who, as I mean, we all are to some degree, but them especially, is kind of are at the mercy of, like I said, hormonal fluctuations, changes in their body. But at the same time, they are trying to learn how to be this being and interface and interact with the world around them. And, immense amount of pressure, because I don't know, I'm trying to learn how to be. And, a big thing that, and I think this is a fundamental difference in trying to diagnose or whatever, but a fundamental aspect, not only being a human being, but especially a young human being growing, is to learn resilience, is to face difficulty, face challenges, face uncomfortable situations, and learn how to walk through those things and develop coping skills, and build resilience. And we do, it's sort of a double-edged sword as we have progressed science-wise and with pharmacology, and coming up with all these new medications that do this and do that. We do, especially in the Western world, have a tendency to sort of default, like, knee-jerk. Oh, you're having like this cluster of 3 or 4 symptoms. Oh, here, yeah, take this pill. And excluding some of the serious, psychological diagnoses, excluding those, the more serious pathologies, there are just normal feelings that come with challenges that one does not know how to face, and that is, I think, especially magnified in childhood, because you haven't, that child has not lived enough life to develop a broad and deep toolbox. And so the anxiety, the stress that comes from, gosh, I don't know what to do here, I don't know what to do here, produces some of the, the trials and strife that, and I don't mean to minimize that. I mean, we've all been there, as children and adolescents. But I think that, especially parents, especially the ones that really, I mean, they want to be the best parent. They want to give this child the best life. They know how. If they don't have a broad and deep toolbox, then they don't necessarily know what to do either. And so again, there's a knee jerk, a default. Well, here, they need medication. They need medication because medication's going to fix things. No, I mean, some children, might need medication. A lot of children need guidance. They need to be shown, how to develop different tools. Sometimes it may be medication. It might be, other outlets. I mean, we as adults, we seek yoga, meditation. We try to approach things holistically. What I would tell that parent is, whatever the child is going through that is producing these symptoms, the fastest way, typically speaking, to achieve relief from those symptoms is to look for root causes. What is it that is causing this small, young being to be experiencing these symptoms? Not like, oh, they're uncomfortable symptoms. Let's make those symptoms go away. No, what can you do as a parent? What can we do as providers? What can we do as a society to give this child, this young person, the tools they need to look at themselves, look at what thing or things are producing those symptoms, and work from those root causes. Instead of focusing on fixing the symptoms, let's look at the root causes. And that's one of the things, like you said, that ketamine just excels at. It tends to take people right to the issues. The brain knows what it needs. Brain knows what serves it and what does not. And ketamine really helps the brain. It gives the brain a couple tools to get right to where the things that need to be addressed can be addressed.
Yeah.
And that I know that was a sort of a long way of answering your question. But yeah, I mean, that ketamine is something that helps you get to root causes and address root causes instead of being fixated on symptoms like we tend to be, again, more so in the Western world than in other cultures.
Yeah. Well, I think that's it too, right? What you said a little bit is like it allows like in the adolescent population, it may allow them to see what equilibrium feels like. And if we can see what that feels like, then we can look at the tools around them so they can learn these coping strategies and coping mechanisms in order to stay at that equilibrium, expecting exactly what you said with the balance, right? I talk about the balance all the time. Like if you hit conflict, you go to polarities, and everybody loves to say everybody's bipolar, but if the brain is constantly sitting at these, antagonizing energy levels and these polarities, it's like, how do we find that equilibrium, that integration, and then how do we maintain that, accepting that our brain is constantly shifting all the time, but we still have to find, kind of that routine piece. And a lot of people are like, they just can't do it, right? Like the kid, rage, anxiety, can't go to sleep, can't turn their brain off, OCD, right? They can't stop, and it's not that these kids can't do it. They've not found the right tools and the right skill sets that they feel internally aligned with that they can actually put into action. So we're giving them, oh, this should work for everybody. Thanks. Whatever. These kids like today, and I'm sure this went on for generations. It's just us experiencing this right now. Kids are their own beasts. They're their own people. And here we are as adults trying to tell them, well, this is what works for us. It doesn't work for them anymore. Their society that they're growing up in is completely different than what we grew up in, because these kids now, they grew up through COVID, right? I mean, they grew up in all these things that we don't understand. But the beautiful thing, exactly what you said, the brain understands what it needs. Ketamine and psychedelics take the brain, they make the brain primary, right? So we can see what's going on with that brain. Then as providers, we can give them more solidified opinions based on what truly could help this child, because we get to see a little bit of that personality kind of in a vulnerable sense. We get to see things that came up. We get to see their coping mechanisms. And this is all at one time, right? So we're getting to analyze behavioral, psychological, emotional, mental health, physical. We could see all these different things at one time, to therefore we can then recommend them kind of a recipe book of like, okay, now look at these things on it, how it could best help support your child, not only the child's mental health, but the child's evolving identity, the child's, activities that they enjoy, and, their intentions that they have, the goals that they have. Because a lot of times, even as adults, we don't know what our true intentions are or what our true goals are all the time from a true internal alignment, because we have so many things on the outside that's influencing us.
Mhm.
Society, relationships, friends, work. We got all these things. And then ketamine and psychedelics, they take that away, right? We get to see the raw version of that person. And that is where our skill sets come in play the most, because all the barriers are down. We get to see the true product that we're working with. And then therefore we get to be the most effective in our interventions, because nothing's getting hid from us. We see it all. And I think that's the neat thing, with adolescents, especially because people think, well, what if it makes them worse? You got a kid, you got an adolescent child here who's just now learning how to live life. And the last thing I would say is to medicate that child, because you're telling the child that, yeah, you're a baby, but here's your medications because you're not acting right. Something's wrong with you. And what does that do? Then that creates this sense of shame, and then
Yeah.
you have this internal damnation, this kid. But instead, if we go to him and say, okay, you have no idea how to handle yourself, and that's okay. Let's come in here, let's figure out, right, this true root cause of what's going on, and let's figure out how to support this little Ferrari of a brain that you got going on. Because, it's something that if we can understand how to share our wisdom from all the things that we've lived over time, and just give you a little bit of our wisdom, see if you can integrate that, and then that's how those little guys and gals find their power.
Yeah. And it's interesting because if we look at how so much, and I'm speaking specifically medically here for a second, if we look at how so much progression, so much advancement we've had in our techniques, not only medically, but surgically and all that, they have been guided. The advancements that we have experienced have been guided largely by our ability to diagnose and see exactly what's going on. And I'm thinking specifically of number one, x-rays, and then, CT scans, MRIs. What those techniques have done have been enabled us to, see past the surface,
Mm-hmm.
see inside, and help pinpoint exactly what issues are causing the outside symptoms, right? So what therapeutic psychedelics, and especially ketamine, do are enable in many ways enable us to see inside the soul, inside the emotional body, so to speak. Outside we show symptoms. We get an x-ray, an MRI, a CAT scan to see what's going on inside. Ketamine is like a way of looking inside
Mm-hmm.
the emotional, instead of the physical body, the emotional makeup, the psychological makeup, and going, oh, okay, this needs to go here instead of where it is. This needs to go here instead of where it is, or this does not belong here. This needs to go.
Mm-hmm.
And ketamine is like doing an emotional MRI or whatever, and going, okay, yeah, everything's good here. No, this needs to be arranged, or this and this and this need to go. They don't belong here.
I tell people it allows us to cheat. Like ketamine is their like cheating agent. Psychedelics are a cheating agent, right? Because you put somebody on ketamine, you put them on psychedelics. It's people are like, how did you come to that conclusion so quickly? And it's because it's raw. There's nothing hiding it, right? There's no filters. The
Yeah.
filters are gone. We get to see, and then yeah, we are the most effective interventionalists ever, right? Which makes it feel more like anesthesia instead of the mental health piece. But yeah, so kids, adolescents, like I would, me personally, if kids are struggling with depression, anxiety, or loss of life thoughts, trauma, if they've had a lot of trauma, chaos, OCD, ADD, ADHD, if they're having emotional outbursts, anger, rage, all those things, I think those are all great candidates to look into ketamine therapies. But two, they're great candidates to look into ketamine therapies having a therapist also involved, because these are very, very fresh canvases
Mm-hmm.
and they need to have those additional strategies from someone to who can help them to start developing these new paths in life, because these kids, clearly the path that they're on, it's not working, right? And they don't have the years of experience to say, oh, I should look at this path. Like, they're really fresh canvases, so having a therapist involved with them, I mean, we've seen amazing results with these kiddos,
Yeah.
from those different perspectives. um, and then you've got adults, right? So a lot of the adults that we see, um, you'll see postpartum depression sometimes. There's postpartum depression that's not resolved in 42 years. Or, police officers, firefighters, therapists, lawyers,
Nurses.
parents, nurses, yeah. Stay-at-home moms. I mean, it's anybody, right? Because we all, as you say, um, it's normal for all of us to struggle sometime during our life with mental health. That just happens
Yeah.
because we hit these evolutionary pathways and sometimes we just get stuck. And unfortunately, I look at people when they say I'm stuck or whatever else. I look at that as their brain's trying to evolve to the next level, and literally they are stuck. They don't understand the next step to take. And unfortunately, what we do in the mental health world is we give them medication that allows them to stay stuck with decreased symptoms.
Mm-hmm.
So we're not giving them the tools that will actually help them to get to that next level to where they actually feel more in alignment with themselves.
Right.
Whereas ketamine and psychedelics do allow that. But yeah, I mean, I would say, people, if they're worried about your mental health diagnosis, bipolar, that's something that revitalists that, we look at these, we look at risks versus benefits, and very significantly, to where we're not going to turn away somebody who is bipolar, who may have schizoaffective symptoms, if we feel like there's certain interventions that we can do to help them. And with those people, especially if they've had mania and things like that, like, we won't take them to a level of diagnosis, or a level of disassociation that may induce mania, or it may induce levels of abstract thought, but instead give them a dose that's low enough to help to ground them, to break it, because we're seeing, you got abstract mental health and you got concrete mental health issues going on. And if we can break those and show the brain equilibrium again, then a lot of times the brain can start auto-regulating itself to go back down to that level. Because as people who have schizoaffective or schizophrenia or paranoid schizos, the world looks at them as they're done. There's nothing else you can do except, maybe take a shot once every 3 months that helps control the symptoms. But as we know, and this is something that I talk about a little bit, but not too much, but every organ system that we have has insufficiency and failure. And I personally believe the brain's the same way. The brain will get to a level where it's not functioning to its optimal level. And if we continue to allow the brain to go down that path, and eventually it goes into failure. And honestly, I think people who are paranoid schizophrenics, like, who cannot function, they're at the really a end stage organ failure sometimes. And it's like, when you see ketamine and psychedelics, when used correctly and appropriately, we're reversing a lot of those symptoms to where we're taking people back from a severe level of distress, and we're taking them back to a minimal level of symptoms to where, wow, look at that. Their quality of life's back. Wow, look, they even got a job, right? And we don't look at that in mental health right now. Like, we don't look at it like it's staged. We look at it as it's all or none. And if we can put it in the category as every other organ that's out there, I feel like it would bring not only a lot of insight, but like bring a lot of hope to a lot of people.
Yeah, I think, there are, again, there are always going to be, with pretty much everything, there are so many things, and especially with mental health, so many things that are on they're on a spectrum. It's not like you said. We tend to, and just to use this because it's a very common example that most people have heard of, bipolar. And historically it's bipolar 1 or bipolar 2. Well, I mean, reality, and this is what I tell patients when I do consults, is like, you know what, diagnoses, sometimes they're helpful, but it really, in this context, at the end of the day, it boils down to, here are the things I'm feeling or experiencing that I don't like, and here's where I would like to be. So I'd rather focus on where you are now, where you'd like to be, and how to get you there.
Yep.
At the end of the day, with some exceptions, I don't really care so much about a specific diagnosis.
I know at all.
I mean,
If anything, I hate
some diagnoses, yes, but for the most of the people that we talk with, it's like, okay, I mean, that's helpful. Definitely want to know that you've had periods of cycling, mania or hypomania or whatever,
Sure.
because we need to be aware of that, as far as the approaching dosing and frequency and all that kind of stuff. But by and large, it's, again, here's this 1, 5, or 10 different things that I don't like, that I feel, that I experience, that I whatever, and here's where I'd like to get. It's like, okay, what can I do? What can we do with ketamine assisted psychotherapy to help facilitate you transitioning or evolving from where you are now to where you'd like to be?
Yep. And I think that's the big piece, right? Is exactly what you just said. The diagnosis does not define the person.
Absolutely.
And the person, and unfortunately providers will look at that as a primary descriptor sometimes. But it's good to hear the diagnosis because, that they have, because I just want to know why. I want to know, just give me just a second. If you have DID, right, your dissociative identity disorder, tell me why were you diagnosed with that? Well, one time I was diagnosed with that because I was listening to a conversation and I forgot where I was. I'm like, okay,
Right.
probably not the correct diagnosis, but that's good to know. Or, it could be, well, when I'm in stressful situations, like I forgot where I was for 2 days. And I'm like,
Yeah.
okay, that actually has significance to it,
Right.
But you're right. And that's the thing about ketamine and psychedelics is you're not addressing the diagnosis. You're addressing the symptoms that may be associated with the diagnosis to
Right.
where, when people, it's 78 or 87. I think it's 78, but it could be 87 percent of people that are misdiagnosed in the mental health field.
Yeah.
It's worse than placebo. It's like, just don't diagnose them.
Yeah.
Because you guys are not doing a good job right now, right? And that's why I need to get the biomarkers and all that stuff involved eventually with lab draws and things. But I think hearing people with ketamine, a lot of them get fearful that they may lose their mind or something like that. And but it's more so the beautiful thing about ketamine is, even though it's an IV for the most part, it's one of the most controlled, shortest acting therapies, or it is the most controlled, shortest acting therapies out there.
Yeah.
Right. So you are in control with this, and we won't push you until you feel like, okay, I'm good. I'm ready to get pushed, and it's like, take it to the next level. Let's go, coach,
Yeah.
And it's all about brain therapy and brain training and all those different pieces. But I think, with ketamine specifically, like if you're looking at contraindications, we kind of talked about that with the mental health piece, but, blood pressure, cardiac status, all that stuff. Ketamine is so transient on anything like that. And as you know, like we've had people who've had ruptured cerebral aneurysms who have done great. Like they hadn't have any defects. We've had people with strokes and they do great with ketamine, and they're using ketamine in the neurologic field to help regenerate things, for neurology now. Blood pressure is another thing that can be completely treated with ketamine to where, it's something that people should look at, and they shouldn't look at it right when they have one foot in the grave and one foot on land. Right. They need to look at it up front so we can actually address it now. Then we can help to manage everything going on in the future.
Yeah.
Yeah. So, So anyway, this will be a good podcast, I think, initially for people to hear, and then we can do additional ones in the future,
Yeah.
getting down to the nitty gritty and all the additional details. But hopefully, this gives people kind of a greater insight with ketamine. So, Matt, thanks for being here.
My pleasure. My privilege.
Yeah. And then if you want to know Matt more, he's in Tampa at the Revitalist Clinic.
Yep.
But yeah, he's also kind of our regional educator and director and all kinds of stuff. So, but I appreciate you being here.
Yeah. Thank you.
Yeah. And then if you guys want to tune in to future podcasts, we'll have those. And if you want to like us, subscribe, or whatever else, or direct message us, we're always here to help answer additional questions. Thanks for listening.